So, welcome to this session on kidney. Okay, as all of you know, that beans are kidney shaped and kidneys are bean shaped. Let us talk about their location. These are the 9 quadrants of the abdomen. The left kidney is slightly higher, is located like this. Right kidney slightly lower, is located like this, occupying the 4 quadrants: the lumbar, the hypochondriac, the umbilical, and epigastric. Hilum of the kidney lies in the transpyloric plane, that is L1 level. It passes through the upper part of the L1 plane, passes through the upper part of the hilum of the right kidney and lower part of the hilum of the left kidney. When we talk about the extent of the kidneys extend from T11, T12 approximately up to the L3 level, and L1 level lies the hilum. Now let us talk about the morphology of the kidney. As we said, the kidneys are bean-shaped organs, but one line about each of its parts. Kidney has an upper pole. One word about it is flat. It has a lower pole. And one word about it is pointed. It has a medial border. And one word about it is concave. Lateral border. And one word about it is convex. It has an anterior surface. And one word about it is irregular. Irregular. And posteriorly, there is the posterior surface. And one word about it is that posterior surface is flat. So upper pole is flat, lower pole is pointed, medial border is concave, lateral border is convex, anterior surface is irregular, and posterior surface is flat. With that, we start talking about the relations of the kidney. And in any abdominal organ, the relations are divided into peritoneal relations and visceral relations. Okay. So kidneys are retroperitoneal organs. And then we talk about the coverings of the kidney. Before we go on to the, but let us talk about the visceral relations first, and then we talk about the capsule of the kidney. So the visceral relations. There are these 3 diagrams which you have to remember whenever you draw the visceral relations of the kidney. Whenever we draw the visceral relations of the kidney. Whenever we draw, one is the right kidney, other diagram is of the left kidney, and the next diagram is common posterior surface. So these 3 diagrams you have to draw while describing the kidney. Okay. So whenever we draw the right surface, the right kidney, or whenever we are drawing the left kidney, the first thing you have to draw is suprarenal area. the suprarenal area on the top. Now, when we draw the right kidney, the second thing you draw is second part of duodenum. And then the major area is hepatic area. Major area is hepatic area. Then is the colic area. And then is jejunal area. Okay, so liver is related to the major part. That's where the hepatorenal pouch is. Anteriorly liver, posteriorly kidney. And this hepatorenal pouch. Now, when we draw the left kidney, we draw a splenic area and then we create a kind of a triangle over here where the stomach is related, here the spleen is related, and then the pancreas on the left side. On the left side, the colic area is small. So this is the colic area and jejunal area is large. Jejunal area is large. Again, I will demonstrate to you in a very fast way how to draw the relations of the right kidney, how to draw the relations of the left kidney. Right kidney, you draw the suprarenal, then draw the second part, then draw the hepatic area. Very easy. Colic area, and then we draw the jejunal area. Left kidney, draw the spleen, then the, the gastric area, then below that is pancreas, and then colic area and jejunal area. Okay. Now drawing the posterior relations, this remains common to both right and the left kidney. Okay, so posteriorly there are four muscles. First muscle is diaphragm. Then draw two lines like this. Okay, I'm little sorry. The it should go like this. Okay, then this is psoas major. Then this is quadratus lumborum. This is transversus abdominis. Okay, transversus abdominis. And then we draw four muscles. And along with that, there are four structures. Of course, the ribs will be here, 11th and 12th rib. But mainly the subcostal vessels. Then coming behind the psoas, the ilio-hypogastric and ilio-inguinal nerves. Okay. So again, I will draw for you. Whenever we draw the posterior surface, draw like this, then draw a line from here, a second line from here. So this is psoas major, quadratus lumborum, transversus abdominis, diaphragm. Four muscles. Here subcostal vessels. Here the ribs, subcostal vessels. Then stomach is above the inguinal region. So ilio-hypogastric, ilio-inguinal. This is how you draw the posterior relations of the kidney. Now coming to the next topic, and that is coverings of the kidney. Coverings of the kidney. There are four coverings of the kidney. One is the fibrous capsule. Okay, which is very firmly attached to the kidney. Two is the perirenal fat. Okay, it is just adipose tissue around the fibrous capsule. Now three, I'm making a star over here for three. And the reason I'm making star over here, it is the renal fascia. Very important. This renal fascia has two layers. The anterior layer is called as the layer of Told, and the posterior layer is called as the layer of Zucker-Candle. Zucker-Candle. Now, see how these two layers cover the kidney. Suppose this is the kidney. Okay, this is the anterior layer. and this is the posterior layer. So this is the anterior layer and posterior. They unite with each other on the top of the kidney. Then they split again to enclose the suprarenal and then go below the. So firstly they unite, then split to enclose the suprarenal, and then they go below the diaphragm. They go below the diaphragm. Inferiorly, they remain separate. Why they remain separate? Inferiorly, this is anterior, this is posterior. So that kidney has to move up and down during respiration. Anterior goes around the extraperitoneal fat of the iliac fossa, and posterior actually merges with fascia iliaca. Posterior merges with fascia iliaca. So this was a sagittal section where we saw anterior, posterior, parasagittal section, anterior, posterior, superior, inferior. This was the orientation. Now when we look at the transverse section, so transversely what happens is, suppose this is the kidney and this is the anterior layer, and this is lateral side, this is anterior side, this is posterior side, this is medial side. So laterally both the layers they unite, and then they are continuous with fascia transversalis. Fascia transversalis. Now medially they remain separate. Medially, okay, and the medially the anterior layer goes and merges around the connective tissue of the aorta, and this continues with the fascia covering quadratus lumborum and psoas major. Okay, so psoas major and quadratus lumborum fascia. And there is a septum actually formed over here. They don't unite, but there is a septum over here, because of which the infection doesn't pass from right kidney to left or left kidney to right. Okay. So this is the kidney, this is the transverse section. And in the transverse section, this is the anterior layer, this is the posterior layer. Anterior and posterior both unite and they continue with fascia transversalis. And medially, it goes around the connective tissue around the aorta, and posterior layer. So this is the anterior layer, this is posterior. Posterior layer goes around the fascia covering psoas major and quadratus lumborum. Okay. Of course, the blood supply of the kidney and the venous drainage of the kidney is very easy. It is just renal artery and vein, renal vein. But based on the blood supply, sometimes some segments of the kidney are described as apical and then posterior and then lower, okay, and then upper and middle. This is based on the branches of the renal artery. These are called as the renal segments. And the kidney drains, the lymphatic drainage of the kidney is in the lateral aortic lymph nodes. Lateral aortic lymph nodes. Okay. Now, kidney nerve supply will be in the renal plexus, which is an offshoot of celiac plexus. Now, kidney normally doesn't, it is asked as a long question, but whenever it is asked, along with the kidney, the embryology of the kidney will be asked. So what is the development of the kidney? The kidney develops, has two parts. One is the secretory part. Okay. The secretory part develops from what is included in the secretory part? It is the Bowman's capsule, the PCT, the loop of Henle, the DCT. So they develop from mesonephros. And two collecting part. So what is there in the collecting part? the collecting tubules or collecting ducts plus minor calyces plus major calyces plus pelvis of the kidney, pelvis of the ureter. So this all they develop from, sorry, uh, here by mistake I said uh, mesonephros. It is not mesonephros. There are here it is the mesonephric duct. Okay, it is from the metanephros. It is from the metanephros. So this, and there are two things uh, are there. Of course, there is pronephros, mesonephros, metanephros. Metanephros is in the sacral area. Apart from these two things, there are two more things that happen. That is ascent of the kidney, because kidney develops in the sacral area. It develops in the pelvis, and from there it ascends to the lumbar area. Okay, and two, the second thing about the kidney is rotation. Okay, it is initially facing posteriorly, and then slowly it rotates so that it hilum, it initially was posterior, and from there it goes medial. Okay, so suppose this is the metanephric blastema and this is the mesonephric tube. So this is the metanephros, and from, and this is the mesonephric duct. From there arises the ureteric bud, and it goes inside the kidney, and this forms the collecting part, the collecting tubules, minor calyces, major calyces, pelvis, and this metanephros forms Bowman's capsule, PCT, loop of Henle, and DCT. Okay, so this kind of acts as an inducting factor. So what is this? This is mesonephric duct. What is this? Ureteric bud. Apart from that, the kidney which develops in the pelvis ascends to the lumbar area, and there is rotation of the kidney. Okay. Now coming to the applied anatomy. Okay, applied anatomy of the kidney. As I have told you previously, that applied anatomy has to be written in under 5 headings. One, congenital anomaly. And when it comes to congenital anomalies, ample material you have to write about the kidneys. Huh? So one is, you can write error of ascent. So kidney remains in pelvis. So this is pelvic kidney. Then error of rotation. Sometimes there is excessive rotation, and hilum faces anteriorly. Okay. Then sometimes when the kidney is developing, the lower ends get united with each other, and this is called as horseshoe shaped kidney. So these three things, what I am now drawing for you, another anomaly where the two kidneys, they unite with each other completely. This is pancake kidney. Okay. And the third thing is the collecting part and the secretory part fail to unite with each other, and because of that develops polycystic kidney. Polycystic kidney. So these are the congenital anomalies of the kidney. So then investigations, you talk about the urogram. Okay, urogram, where a dye is injected inside the veins, and that dye in 15 minutes or 10 minutes appears in the kidney. We take the X-ray, then we check Then you have to draw about a plane KUB view, kidney, ureter, bladder view, or X-ray, which is done of the abdomen, where to view the kidney, ureter, and bladder. Then USG is also done to check, because kidney is a soft tissue, to check the stones. Medical problem, nephritis, glomerulonephritis. All this common in diabetic, hypertensive patients. Okay. Infection also can cause nephritis. Surgical, the renal stones. Okay. Renal stones very common with those who drink less water. So drinking more water is very important. And then there is removal of the renal stones by various ways, the lithotripsy and all other methods. And the last is the cancer of the kidney. Cancer of the kidney. Okay. So these 5 points you'll write the applied anatomy. So thank you so much.